So our third topic is on taking action. So what do you do when you have data? So one thing I'll point out is Bryann's project did not connect to resources. As you heard, there was a big angle on this around research, but I'm going to ask you to talk a little bit about that. We've pulled some of your results from your project out from a presentation that one of our team members, Dr. Rose Hardy, gave at the American Public Health Association around what we were learning from this project. And you'll hear more about this from Bryann, and then I'll ask one more last question about how to use the data, and then Caitlin and Nick, also the same question about, what does it mean to have this kind of data, and how can it improve the way that we serve people? So Bryann, you have a few more slides, and I'll let you walk through these.
Yeah, absolutely. So on average, veterans had 3 people in their social network. And so we didn't really have a sense of how many people veterans would have in their social network prior to, doing this work. And the average, or the range, was, I believe, 0 to 22. So there were, quite a range in there, but the average was 3. And then the majority did not have anyone to help them with their needs, which was very surprising. So, as I mentioned before, so, they have a small network to begin with, and then those network members are not reliable in terms of being able to help them when they experience needs. And we did see this rise from the pandemic in needs. And we know that a lot of those needs are associated with suicide risk. So we are getting a much more nuanced picture of what's going on with veterans from this analysis. So now we can see more of the fact that veterans have these needs. They're not able to rely on their social network, and that's increasing their risk of suicide. So what we see here, we're also interested in something that's called social cognition. So those are the skills that underlie social interaction. And that has been studied probably the most in autism and schizophrenia, but I'm also interested in that in relation to post-traumatic stress disorder as well. And so we also had that in our model too. And so what we see here is that, we have this, we have our social network analysis. Higher scores indicate worse social connectedness, and higher scores on PTSD and depressive symptoms indicate higher PTSD and depressive symptoms. Higher scores on suicidal ideation indicate higher suicidal ideation. Higher scores on social cognition indicate worse social cognition. And the measure we use is a measure of social cognitive bias. And so if you're in an ambiguous situation, how do you interpret that situation? Do you blame somebody else, or do you blame it on the situation? And so what we see here is that, the worse social connectedness somebody has, the higher PTSD and depressive symptoms someone has, and then the higher the suicide risk as well. And social cognition contributes to all of this. So the worse social cognition, the worse social network they have. The worse social cognition, the more PTSD and depressive symptoms they have. There are also indirect associations between the social network and suicidal ideation through PTSD and depressive symptoms, as well as social cognition to suicidal ideation through the social network and PTSD and depressive symptoms. So we get a lot more of a clearer picture in terms of, where are we going to intervene here? Well, we have a lot better understanding of what's happening with our veterans. So the quality of social relationships worsened during the pandemic. The poor quality of relationships was associated with increases in mental health symptoms and subsequent suicide risk, and low social cognition contributed to those poor relationships. And many veterans didn't have anyone in their social network that they could rely on for their needs. So if we're thinking about, what are we going to do next here? I think that we really need to be working on, what is the VA's role here? Because the VA has a role in providing veterans with a lot of resources. But I don't think that the VA understands the extent to which veterans don't have strong social support networks surrounding them to address their needs. And so, if you think about things like food insecurity, the VA doesn't typically help with something like that, but that can really contribute to, poor outcomes in a veteran. And so I think that we need to be providing more things like intensive case management. So the VA started doing that internally, but we need to also be providing external resources through intensive case management, really understanding the veterans' individual situation in terms of their social determinants of health, and helping them, with additional resources, and trying to help them build their social networks in order to reduce mental health symptoms, improve suicide risk, and improve functional outcomes as well. And so, next steps of this work is that we're in ongoing data analysis for publication on this. And there are a lot of different findings as well. Again, could talk about this for a long time, but we're short on time. So just really a huge thank you to VNL. We would have never been able to do this without the expertise of VNL. And this is really a kind of a dream come true project for me. I've been wanting to do this for a long time, but just didn't have the expertise or know-how myself, and being able to partner with VNL was really wonderful. They're an excellent company, and just really appreciate all of their help and support on this project, and looking forward to getting all this published out in the world and our continued collaboration.